Hi, I'm Andrew Scott and I'm the practice principal at Andrew Scott Dental Care. Much of the work that I do revolves around the placement and restoration of dental implants. A dental implant is a titanium screw which is inserted into the bone of the jaw. People that have lost teeth or people that are about to lose teeth often find that this is quite debilitating to their confidence and the appearance that it's going to leave them with. Having dental implants means that they can get a fixed replacement of their natural teeth. It means they can't take them out or in, they don't move when they speak or when they smile, and the end result is a very natural appearance, as close as we can get back to having the natural teeth there again. The best way to replace missing teeth is with dental implants. It provides an artificial root for the tooth and a natural looking crown to be placed on the top of it, which looks really like the natural tooth as well. And it's fixed in so patients can't remove it. It just acts very much like their normal natural tooth would be. A client would come in and have an initial consultation with us. At this appointment we would have a general check around their teeth and gums, make sure everything's looking healthy, see what the bone levels are like in their mouth. We would also take certain x-rays and perhaps impressions for study model. From that we would be able to make up a treatment plan, and at the consultation as well we would discuss what the situation is with the client and a few different options depending on what we've discussed at the time of the consultation. Talk them through all the pros and cons of each individual treatment, all the different options that are available to them. After the consultation we would agree on the treatment plan that we're going to proceed with, and then there would be the next stage really would be the placement of the dental implants. This is a small surgery which takes not that long, and then once the implant is healed after about 3 months or so, we would normally take some impressions. We can send these off to the dental laboratory and then they make up the natural looking teeth for us, which can be either crowns or bridges or dentures which fit on the top of it. So all in all it might take 4 to 6 months from start to finish. I've been placing dental implants now for almost 20 years, and during that time I've done extensive training so that I can achieve higher success rates and more natural looking results for my clients. Giving people back their natural looking teeth is one of the happiest parts of my job, and it's something that we're very passionate about here at Andrew Scott Dental Care.